If you're someone who generally you're pretty healthy, you can likely manage a COVID illness by yourself at home. And that would mean just managing your symptoms. There's not a medication that you need if you're not high risk for being hospitalized. And so it means taking Tylenol for muscle aches or a little bit of fever. You can take over-the-counter or cold medications if that gives you some relief, pushing fluids, resting, listening to your body. We usually recommend that if you're having really significant symptoms, and by that I mean you're feeling very short of breath, maybe you have a persistently elevated temperature, of persistent fever, you're very weak, you can't keep up with fluids, so you're getting dizzy when you stand up. Any of those symptoms where you're having trouble managing at home, that would be a time to seek help. It's important if you're someone who has higher risk for being hospitalized for COVID because of your chronic diseases, your age, because of your immune status, then knowing that you're COVID positive might help guide some additional treatments if they're available. Many of them are in very limited supply. The other reason why testing can be important is that it gives you that extra push to really isolate yourself and make sure that you protect others from getting COVID. That being said, any test right now is a good test. So if you have a home test, a rapid antigen home test, and it's positive, you should take that as meaning that you have COVID. When we have so many people with COVID right now, the likelihood that that test is accurate is very, very high. The CDC recently, for non-healthcare workers, has changed that to 5 days, but that's with some caveats. 5 days is when you're not having fever, your symptoms are better or very minimal, and you have to continue wearing a mask at all times when you're around other people until you've gone through that full 10 days. And the clock starts from the first day that you experience symptoms, or if you didn't have any symptoms, from the first day that you tested positive. The thing that I really want to make clear, because this is what you hear from a lot of people, well, those vaccines don't work. They haven't prevented me from getting COVID. The vaccines were never designed to keep us from getting COVID. That's not what the studies showed. What they are doing is preventing us from getting really sick from COVID, needing to be hospitalized, and dying from COVID. What we know now is that this Omicron variant, it seems to elude, it gets around the vaccines. We also know that immunity starts to wane, it starts to decrease over time in pretty much everyone. And that's why the booster is important, to sort of rev your immune system back up and give you protection from these newer variants.